Imagine getting put on an antidepressant called Elavil for nerve pain that you're experiencing. You take it for 6 years, not knowing that it's an antidepressant, and then you decide to come off. Out of the blue, you start to develop severe anxiety, and you feel like you're losing your mind. You end up hospitalized 3 times despite never having had any psychiatric problems before. You even get electroconvulsive therapy. However, you find out soon that you've actually developed a drug injury, a withdrawal injury from the antidepressant that you were prescribed, not for any psychiatric reasons, but for the treatment of nerve pain. What follows are several grueling years towards recovery. And so if you're interested in a story of a woman who was pushed to the brink by withdrawal injury and has now safely made her way back from it, stay tuned for Tiffany's story. Tiffany, thank you so much for coming on to share your story about amitriptyline or Elavil. And so I think a good place to start is if you could just tell us, how did you end up taking this medication to begin with?
So Elavil, the brand name, which is by the generic name amitriptyline, was prescribed for a nerve pain condition called vulvodynia. And it's a nerve pain condition that causes, chronic pain in that area. So it's a little bit of a weird condition to have to tell people about. But it was prescribed for that. First, they used a compounded gabapentin amitriptyline cream, and then they prescribed me. Once that started to work, they upgraded me, I guess, to 150 milligrams of amitriptyline.
Mm-hmm. And did it work? Was it helpful for the nerve pain?
Yes. Both treatments they tried did address the nerve pain completely.
Mm-hmm. And so, I understand from when we talked before this, you started to have, clearly you started to have problems when you were coming off, but what was the story about deciding to come off? When did you realize that you didn't want to be on amitriptyline and all of that? How did that come about?
A couple of reasons. One, because my doctor, my prescribing doctor, told me that once the nerve pain was addressed, you would no longer need to stay on the medication, basically implying it's permanent, which I've actually found out later it's not. But the other thing is that I just realized I was on a medication I didn't need. It's important for me to say that I was actually staying on this medication, knowing that I didn't have to be on it, or under the impression I didn't have to be on it. I was staying on it for 6 years because it helped me sleep. It was like a sleep aid that didn't cause any daytime grogginess or drowsiness. I decided to come off of it because I realized I don't actually need this medication. I should just come off it.
Mm-hmm. And just because, amitriptyline or Elavil is maybe one of the less common antidepressants, I'm just going to share a little bit about what it is. So it's one of the OGs, the very original, like probably one of the second or third antidepressants that ever came on the market. Probably came out in the late 50s or early 60s, and they're called tricyclic antidepressants, and they were the drugs that the SSRIs were sort of based off of and developed from, and they were considered to be these sort of dirty drugs. They had a lot of effects at different receptors. They affect serotonin, norepinephrine, histamine, alpha 2, there's all of these different receptors. So they kind of hit everything. And because of that, they have a lot of different effects. And so, like the SNRIs, like, Cymbalta, they can have pain reducing qualities, which is what Tiffany was getting prescribed. It prescribed for, like some of the more histaminergic antihistamine drugs like mirtazapine. It can be sedative, and so it also has a sedative profile, and it can also be an antidepressant as well. And so it does all of these different things. But people don't use this drug as much anymore for depression because and especially in people who are depressed, because if you overdose on it, it can be lethal. It can cause cardiac arrhythmias. And so mostly now you see amitriptyline used in non-depressed patients like Tiffany who aren't at risk of suicide, and they're using it for nerve pain. But yeah, it's definitely an antidepressant. And so it sounds like you started to realize that you didn't want to be on the medication long term. Did you receive any guidance about how to come off this medication when from your doctor?
I did not receive guidance from the original prescribing doctor. I found a local. I don't remember if she was like a general practitioner or she was psychiatric. I think she was actually general. I don't remember going to a psychiatrist's office or a special center. I think she was just like a local doctor I found. And so I did get guidance to titrate off of it. Nobody questioned why I wanted to go off of it. They just said, okay. And I went off of it. It took me about, I think it was around 6 to 8 months.
Mm-hmm. And tell us about that process. What was it like tapering off the medication?
So, in my experience, there were no recognizable symptoms of anything until a few months. I would say at the 2-month mark, I started to notice, like, I guess you would call them more of affective symptoms. They were just very minor lack of motivation and lack of, how do I describe it? A lack of emotional vitality. A lack of happiness.
This is 2 months into your taper.
What was
right?
that?
This is like while you're tapering, right?
Yes, this was a few months into the taper. Yeah. I started to notice, what I'm trying to say is it was a lack of motivation, and you started to notice symptoms of, I guess you call it anhedonia, right? That's the term. So, yeah.
Yeah, like a hard time feeling joy, you know,
excitement, joy,
and activities that you used to do, feeling like engaged and motivated. And it sounds like you also felt kind of flat as well coming off. Yeah,
flat more so in that I couldn't feel positive emotion. And, but I didn't know, I had no idea it could be due to the medication. In fact, I thought it had to do with me overtraining because I was into weightlifting. I thought it had to do with me overtraining. And I also thought it had to do with like a mid-20s crisis. I was just trying to find online what could be the cause of a sudden lack of interest in things. And those two things were my working theories at the time.
Yeah. And it's interesting, right? Because you don't get on these medications because you're having, a lot of depression or something like that. You're getting on it for nerve pain. But now when you're withdrawing and you're experiencing withdrawal, you're starting to, I guess have classic antidepressant withdrawal symptoms, lack of drive, lack of joy, things like that. And you're not, if you're on these antidepressants because of a psychiatric reason, oftentimes doctors or even patients will say, oh, my mental illness is coming back. But you didn't have a mental illness to come back to. But it was interesting that instead of recognizing that your brain was in withdrawal, it started to sort of make up these reasons to understand the symptoms. I mean,
I wasn't given any advice or warnings about withdrawal that were those symptoms. I think I was told about insomnia and headaches, maybe digestive issues. I was told about those that you associate more with like typical mild withdrawal from antidepressants, but not any affective or mood symptoms.
So walk us forward from there, because I know things take a drastic turn for the worse. How does the rest of this withdrawal play out for you?
So,
this taper, sorry. Yeah.
Right.
Yeah.
As I continue to taper, the symptoms of the anhedonia and the lack of motivation, of course, they get worse. And I begin to see a therapist. She was very nice, but, she could only do so much for me. So this is now in 2021. So that was when I went off the medication in the summer of 2021. And the symptoms began to turn into anxiety. So I was now beginning to, either due to being unable to actually understand what's happening to me, causing psychological anxiety or some kind of physiological anxiety. I don't know, but it started to happen. I started to have severe anxiety, insomnia, and then at the very end of the taper, panic attacks. So all the symptoms you associate with severe anxiety, I was having them. And it was that summer, let's see, I actually have notes here that says when my first hospitalization was, okay, actually it was May 2021. I had an emergency room visit, and then they admitted me to my local hospital in their...
So did these withdrawal symptoms get to the point where you were like suicidal, or were you just severely depressed and you're like, what's going on with me? Like how did you get into a psychiatric hospital? I would describe it as suicidal ideation brought on by severe anxiety. Okay. At that time, were you aware that it was amitriptyline withdrawal, or did you just think you were losing your mind because of, things in your life?
At that point, I suspected it was the amitriptyline. It was at the end of the taper.
Okay.
Things were getting really severe. I actually reached out to Surviving Antidepressants. The website, which I know that you're familiar with, we're all familiar with, and I actually posted there, and you can see my post, and look how far I've come. But yeah, I suspected it was the amitriptyline at that point.
So what was that experience like going in the hospital? Was that a helpful experience? How did that play out?
Well, lucky for me, it didn't just happen once, but 3 times that year. I was admitted to my local hospital, then I was discharged. And then again, I think in October of the same year at a different psychiatric ward somewhere else. Then I did an outpatient program. And then once again at my local hospital in December of 2021. So it was 3 times.
Okay.
And I saw their psychiatrist. They did not recognize it as any kind of antidepressant withdrawal. They suggested it was a kind of relapse, but there wasn't much discussion. I didn't really get many answers from any of the psychiatrists there. They tried to put me back on the amitriptyline at 150 milligrams. Initially, that didn't work. No changes. Then they prescribed me lithium and quetiapine. So I was on, and they changed me to Cymbalta. So they did prescribe me Cymbalta, lithium, and quetiapine. Those were the 3 drugs I was on that year. And that was when I started to get...
Were any of those...
Sorry.
I was going to say, were any of those helpful, Tiffany?
No, I don't want to scare anyone because there's a good end to this story. But from my experience, none of the medical interventions I tried had any effect on the condition I was going through. So the medication, I did end up getting electroconvulsive therapy from December through January. So December 2021 through January 2022. I also tried transcranial magnetic stimulation and even Spravato, which is the new ketamine nasal treatment. But yeah, none of those.
Yeah. So I'm going to jump in here because this is a really typical story for a protracted withdrawal injury from antidepressants, where as you're coming down off the medications, and I mean, we don't know why it happens. I suspect it's something to do with like excitotoxicity. You know, just being in withdrawal is just damaging to the neurons for some people. And so you're coming down off the medication. Probably the most common symptom I see happen to people is that they just develop this sort of maddening anxiety that's just always there, you know, catastrophic negative thoughts. And there's also a degree of cognitive impairment as well, which makes people feel like they're losing their mind because they can't concentrate or think right. And the anxiety is always there. And what really makes this, you know, this is why it isn't a withdrawal problem. Like you're not in acute withdrawal now. You've had a neurological injury because you reintroduce the drug and then it doesn't make you better.
Yeah.
And yeah,
that confused me
sometimes
too.
For some people it even makes them worse. Yeah.
I thought if it's withdrawal, you go back on the medication, but it had no effect. Kind of getting into weird territory because it's not like classical withdrawal. So yeah, you can imagine how stressed I was, seeking. I mean, to be fair, I mean, it was disordered seeking of medical treatment. I was so anxious and stressed that I was continually seeking out medical treatment over and over. Because, you know, I was trying to avoid
because that's normal. Because anyone that gets to that level of, you know, anxiety and they start to feel suicidal and they're talking to their loved ones and you say, what do I do? Like, I'm losing my mind. What do I do? You go and see the psychiatrist, and then you go and you try something and it doesn't work, and you know, go and see someone again. And then, much like what happened to you, and I would talk to a lot of people with these injuries, and you kind of have to go through this almost this realization that the mainstream system can't help you, because what happened to you happens to many. You know, they'll get put on antipsychotics, they'll get put on lithium, they'll get put on more medications, they'll get ECT, TMS, because that's what the psychiatric doctors do. You know, when you come in, they go, oh, you know, we're just going to treat you with these drugs because, you know, you have treatment-resistant depression or bipolar, or they're just using it symptomatically. But it does not work after someone has developed a protracted injury because the nervous system is so sensitized that they just have more bad reactions to it. And so people end up getting worse, I find, by traditional psychiatric interventions.
I mean, I agree with you because it was in that December. I remember they just put me in a wheelchair and they wheeled me down to the endoscopy unit and were like, this is electroconvulsive therapy. And I was like, okay. I didn't even at that time. I had no judgment towards any of the treatments I was on. I didn't care about the severity of them. You hear some people have an attitude of they don't want to go on medication. They don't want to do these treatments. I was the opposite. I was more than willing to go on any treatment that they could offer. So,
when did you get to the point when you realized that these medical interventions weren't going to help you?
I kept trying through 2022, 2023 was when probably at the end of 2022 because I just ended Spravato treatment. But the reason why I probably stopped was because I was actually starting to get a little better. So it was at the end of 2022. I remember exiting the Spravato. It was a psychiatrist's office that offers Spravato, but I remember feeling for the first time in like over a year, like this tiny hint. It was this tiny hint of levity. Just walking to my car. It was completely spontaneous, and then it went away. But I noticed that. I remember that moment, and that was probably a turning point for me. But yes, I did continue to, for a long time. I was seeking out many medical treatments and medications. I can't even list the amount of different medications I was on. I was never on a benzodiazepine. They never put me on a benzo or anything like that. But I was on lithium and antipsychotic and an antidepressant. So,
bring us back to 2022. What is your state of mind at this time? You know, you've gone from being functional to all of a sudden not able to work. I guess not able to do your graduate training. You're also really disabled. You've had ECT. You're in and out of the hospital. What was that like for you to find yourself in this place? You know, you're on surviving antidepressants. What's that like?
I would say I was having a lot of disordered, anxious behavior. So realizing now that anxiety a lot of it is really behavior based. I was thinking and behaving in anxious ways. So the biggest symptom of this entire experience I could describe that's most salient is an inability to handle stress, right? Now, stress and anxiety, I know there's a fine line between them, but I had to obviously take a gap year between finishing my graduate degree. For a time, I was not working, but I think that year I did go back to working part-time. Though it was very, very stressful. So, the whole experience, and this is what I hear from a lot of people. They say that I just can't handle things anymore. And then there are a lot of other symptoms that are they're not like symptoms, but just more thought processes that happen. So you become very, very frustrated because you're in a system that is not equipped for this condition. So you become very cynical and frustrated towards medical professionals. You many people who deal with anxiety become very, I guess, self-absorbed in a worrisome way, thinking constantly about the condition, Googling the condition, going on forums, fretting and thinking constantly about it, and just an unending cycle of worry and anxiety, knowing that you're disordered, but not knowing what to do about it. You are continually trying to seek out treatment for it. And then the last thing is feelings of guilt and shame, feeling like I didn't feel like I deserved this or that I caused it. I just felt guilty because, for no real logical reason, I guess, feeling more like shame because the anxiety was causing me shame. Like, how could you, you can't even do art anymore. Like, you were already a useless person being an artist. Now you can't even do art. Like, that was the thought process. And very, very, just beset in negativity all day, crying spells. I remember watching I remember a big moment for me when I was rewatching this film, Spirit, Stallion of the Cimarron. Still one of my favorite films. It was a DreamWorks film that came out in like the early 2000s. And I remember just watching that. The whole movie is about this stallion that's like free and is captured by humans and is trying to get back home to be free in the great old West. And I just remember, I know that's really corny, but like I had the biggest breakdown because that metaphor was like so powerful for me. So I could go on and on about metaphors for what it was like, but unless you're really in that kind of state, it's very difficult to describe.
Yeah, I think what you've described is really common, especially the part about being all consumed with the anxiety and what's happened to you, to the point where it can be really hard to relate to others because it's your whole world, what's happened to you. And other people are just like, where's Tiffany gone? This was the person who I used to talk to about this and that. Now she just, is always talking about, what's happened to her.
Yeah.
And
you always talk about it.
I think that's really normal.
You just become like every conversation, you're like, with your friends who are okay with you talking about it. I had good friends and family who never got mad at me for talking about it. They were very patient with me, but yeah.
So it sounds like at the end of 22, you experienced your first kind of window, and that gave you hope that you would recover. Talk to us about what happened from 22 onwards. What was that process of healing like? How did that play out?
Well, in 2022, I was admonished by my parents to finish my graduate degree. Just do it. And I did it. I didn't, even though I felt like I wasn't ready, I did it. And I did it somehow. But I did it. I graduated in 2023. And of course, you can imagine not having any real coping skills with the stress. And, but thankfully it's a fine art degree. So it's pretty easy to kind of fake it till you make it with that. But, what I mean by that is like, there's no intense studying you have to do or intense exams or apprenticeships I had to do. And that gave me some hope that, well, I was able to achieve this. This is now 2023. I was able to achieve this. My symptoms abating a little bit. It's not 100% misery every day. Now it's more like 75% misery some days, 25% misery some days, and then 100% misery some days. So the wave and window pattern that is described on surviving antidepressants is very accurate. It very much is like that.
Mm-hmm. How long do you think it took for you after you first got hurt to start feeling like your level of functioning had returned? I mean, it doesn't mean you completely didn't have any symptoms, but you were back to living a mostly normal life.
Probably like 2024, because that was when a lot of clarity came to me about the condition of anxiety and how much anxiety had influenced my condition of antidepressant withdrawal. It's in 2023, I was pushing myself forward so much that I went to the ER because I was having extreme chest pain, and they took plenty of tests and said, there's nothing we can really tell. If you want to get your gallbladder removed electively, you can. And I did. And it didn't stop the chest pain. And I learned that it was a panic attack. So, that was a new symptom, like the chest pain. I never had that before. Very severe extreme chest pain and nausea. So, but anyway, that's just another symptom. It's just another symptom of anxiety. And, once I learned in 2023 that I was experiencing anxiety acutely. It kind of made me realize something, which is that I need to stop worrying about antidepressant withdrawal, and I need to start addressing anxiety. And in 2024, I started to do meditation, and that spurred the recovery. The recovery is kind of like this. Is that called like a hyperbolic curve? It's like once you know something about how to recover, it leads to quicker recovery over time because you are accumulating all these good habits. So in my experience, so from 2021 to 2022, very slow progress. From 2023 to 2024, very moderate progress. And from 2024 to now, quicker progress. But I don't know. I thought that might be
recovery is. It is interesting to talk about. It's interesting, and I want to be careful here because there's so much variation with these protracted injuries, and then there's there's this what makes people better, and I think about two things. One, it's like straight up just like neurons healing, and it's just like brain healing, because when the brain is really disordered, it really isn't like a mind over matter thing. It's just the brain just spazzing out, generating crazy neurological emotions. There's not much reasoning with that. But then there's also the other side of it, which is the almost the coming to terms with it. So you always have this sort of the sensitive nervous system just kind of spazzing out and causing a lot of anxiety. But then there's also fear, because there's fear about, what's happened to you. And there's fear about, am I going to be like this forever? But, once you start to turn a corner and you start to feel more hopeful, once you start to become more familiar with the symptoms and realize that, it doesn't mean that you're dying, that your heart is beating out of your chest, it's just signs of a damaged nervous system. Once you've kind of gone through the process of, hey, my life has changed and, I've accepted that I've had this injury, a lot of those things will bring the volume down. But it also sounds like with you, Tiffany, that you got to a point where you were able to be more proactive in how you were handling the residual anxiety. You were able to find different ways to sort of naturally kind of bring it down. And so it's a sort of, I feel like it's a combination of these things happening together. And it's not really sure like why the healing is happening. I think that the neurons healing is a big part, but there's also, moving through the grief process, learning the skills, and together, I think it just makes people feel better gradually over time, just like with you.
Yeah. So, I mean, I think when your anxiety is so severe, it is difficult to really be proactive in any healthy way because you are trying so hard to escape the pain. That creates very anxious behavior. Like, I need to fix this. I need to escape this. I need to control this. I need to make this go away. It's a natural impulse. But when it abates to an extent, you can now start to see the greater picture of that anxiety, which has controlled you. You can now begin to untangle that, which takes years. Many times in my experience, it will take more years, but I began to read. It's funny because in the beginning I was reading books about anxiety. I was doing CBT but it was only like years later when I was able to kind of calm down to an extent and come to terms with it that I realized how much I had been feeding that behavior. It's and I'm in no place to make any recommendations on how other people should heal, but it does seem that, like, I guess you could do everything wrong maybe, and like you still heal to an extent. But in my opinion, to really recover from an anxiety disorder, which this is for me, it takes changing your attitude, your mindset, and your behavior. So, yeah.
Mm-hmm. Question for you. When you were in the thick of it, when it was really, really bad, what kept you going? Because, I mean, you had mentioned that you'd had suicidal thoughts during it. How did you decide to hang on and see this out?
It was more like an innate survival drive of not wanting to actually succumb. When I was suicidal, it was more so out of complete desperation of wanting to die, but not wanting to actually take any action. Throughout this entire period was extremely intent on recovery. I was to an almost like obsessive negative way, but it was an innate drive to survive and keep going. I mean, and that's why I'm here today. Despite all those periods of complete breakdowns, hospitalizations, bad choices, I guess I never really gave up. You're allowed to like give up a little bit. I mean, like, you can have your breakdowns and give up, but in the long term, it's a steady desire to live.
Yeah. So another comment that I just want to make here is that Tiffany's recovery so far is really typical from what I see for this. I know a lot of people will go online and they'll say, I'm going to be bedbound for, 5, 6, 7 years, something like that. And there are cases like that. But just in my practice, from the people who walk through my door, usually, 18 months to 2 years, they're already returning back to their life in some way, whether, they may not be fully feeling well, but it's enough to return back to life. Many people feel very, a lot better by about the 2-year mark. That's the most common thing that I'm seeing from these withdrawal injuries. And so what I'd say, Tiffany, is this is probably the most normal protracted injury story out there. And I think that's reassuring to people is what I want to say, because often people think it'll be much worse.
Yeah. Guess what I thought? I thought it was going to be much worse too. I mean, I didn't even know what to think. It was scary. I didn't want to think about what could happen. Like, I didn't know, I do. I see these comments online and, saying that like, it's been 10 years, it's been 8 years and I still have symptoms. And, look, I don't know. I don't really know. I can't vouch for those comments. But I got to be very careful with what you're saying here, because I don't want to make any false impressions about things. But I don't know what to tell you. I got electroconvulsive therapy. I know, like, look at me now. Mm-hmm. I'm working full time. I mean, I'm working full time, and I mean, I'm still figuring things out. But it's another thing. I mean, it sort of speaks to the nervous system's ability to heal itself, that you could have a brittle nervous system. You could get ECT and you can still bounce back from it. It doesn't mean that the healing can't happen, just like it happened in your case. Yeah. And something really important I want to say here. And I said before, things changed when I stopped focusing on withdrawal and I started focusing on anxiety, because it does seem to be the case that for many people, antidepressant withdrawal's main symptom is anxiety. Would you say that, doctor, that anxiety is like at least a key symptom? So the way you heal from antidepressant withdrawal with anxiety as a key symptom is to address the anxiety. And that is like, once you start addressing that, you will heal. I mean, for me, medical anxiety, and meta anxiety, which is anxiety about anxiety, was the key driving force behind this. You were anxious about the anxiety. And once you realize that this is happening, you can start to address it. But if you, I implore people, do not fall into a trap of fear about your neurotransmitters not healing or your brain shrinking. I mean, I was reading research papers about how antidepressants shrink monkey brains in tests, and how neurotransmitters shrivel up like, dead plants never to grow again. That's actually anxiety talking right there. Like, your neurotransmitters are, in most cases, they'll be fine. I mean, it's like worrying about a cut, right? Like, my cut, what if my cut doesn't heal? What if the skin doesn't heal? I mean, it's going to heal. It's you worrying about it. You are creating a problem. But I don't blame people for doing this, because it's natural. It's natural to do that, so.
It is very natural. And eventually, I mean, at the beginning, I think you're afraid and you want the validation. And so people go online and they, search out groups, and they need to be really in there to feel heard and to understand what's happening. But you're right, there does become a point where leaving it behind and resuming life and just being kind of engrossed in life and having those natural distractions, it's like a tipping point. It's just a better place to be, rather than kind of dwelling on what's happened, but trying to move to life. And it happens at a different stage for everyone, but eventually that is the way to go.
This is crazy to think about, but I never had any clinical anxiety or depression, and I need that to be clear. But I have always had what you call a neurotic personality. And I've been prone to social anxiety. Now, that has gotten better over time, but this experience kind of made me realize that I have, though not serious, I have considerable issues with anxiety that 100% affected my withdrawal experience. And if we're to heal from withdrawal, we also have to heal from our maybe proneness to anxiety, making peace with it and understanding it, and seeing it as a tool for our recovery rather than an obstacle, which again takes a long time. And I want the protracted withdrawal spaces to become very positive places where people can see it as an opportunity to maybe see, do I have endogenous, or do I have innate impulses towards anxiety or depression that are making this worse? Is there a way to disentangle this artificial, I guess, chemically induced anxiety from our own anxious behavior? And this is a very complex topic I'm not qualified to talk about, but once you realize what anxious behavior is, your entire life will change. So I just, want people to know that this isn't just about healing from withdrawal, but sometimes it's about coming to terms with your own lifelong discordant or disordered behavior. I mean, I remember in the beginning I thought, I'm fine. I have no problems with anxiety. Why is this happening? I never had anxiety disorder. I never had generalized anxiety disorder. I never had panic disorder before, which is true. It's true, but two things can be true at once. Antidepressant withdrawal, or maybe there'll be a new term in the future that's more exact, but this is a real clinical manifestation of some chemical change. But we can also have, issues with anxiety in general that are not caused by the withdrawal. And maybe to actually heal, we need to address both. that's my spiel.
I think it makes a lot of sense, and it is a complex thing to try and figure out, how much of this is completely out of control and how much of this is something that, I could play an active part in. And for each person, it will be different. There'll be some people where it's a lot of it is mind over matter, but there'll be some people where it's just supporting someone while the neurons heal. I see both spectrums of things. But even if you're having a lot of neuro emotions, engaging in whether it's CBT exercises or mindfulness or different strategies to address them, they still help even if the symptoms are coming from the brain. And eventually, as things clear up, you'll have this whole toolkit of great strategies to address any underlying anxiety that would have been there.
Yeah. And if I could recommend, it's very ironic. And this whole story is so ironic. It's like poetic irony at its finest. Like all the medical interventions I tried didn't work. But guess what did work? All the interventions that are proven to help for anxiety that are safe and effective, like meditation and cognitive behavioral therapy. Like, I just find that so funny how that yeah.
Who knew that drugging the brain wouldn't help it in the long run? And
I don't feel like I have no ill will towards. I don't have a lot of ill will towards psychiatrists in general. I just wish there was more awareness about, how antidepressants affect the brain. I just wish there was more support out there, more people like you who are willing to take tapering seriously. And this could be a whole new field, a whole new specialty in psychiatry. I mean,
okay. Well, Tiffany, on that note, any final comments before we wrap for the day?
Am I allowed to recommend resources for people or no? Because I don't have to.
Absolutely.
But, okay.
Go for it. Yeah.
I recommend the website anxietycenter.com for people because the attitude that the therapists there take is very positive, and it I believe any source you can find of someone who's dealt with anxiety, who overcame it, is going to give you a lot of insight. So books, YouTube channels, people who have overcome anxiety. And lastly, I want you to understand that one day this will all be a teaching moment for you. You're going to look back on this and say, that was a crazy time in my life, and I've learned a lot from it. So I would say that to people. Yeah.
Well, Tiffany, thank you so much for taking time out of your Saturday to come and speak with my audience about your experience and your recovery.
Thank you so much, Doctor. It was a pleasure speaking to you, and just keep doing what you're doing. You might get a Nobel Prize someday for it.
Well, thank you. If you're interested in learning more about surviving antidepressants, which is the #1 place where people go to learn about getting through protracted withdrawal and tapering off their medications, you're not going to want to miss this interview that I did with the website founder, Adele Framer.